front of a large crowd like this in a very long time. But because David is a very good friend of mine, I decided to gather up the courage to be here today. So my name is Maureen Kono. I work with Cities Rise, but today I'm not here to represent Cities Rise. I'm here to represent Youth for Mental Health Kenya. So just briefly, Cities Rise is a global platform that is committed to transforming the state of mental health policies and practices globally. We are currently in 4 countries and 5 cities, but we're in the process of adding 2 more cities. So we are currently in Nairobi in Kenya, Bogota in Colombia, Chennai in India, Sacramento and Seattle in the US. And then we plan to add Cape Town and Stockholm very soon. So I'll talk briefly about for mental health because I've given just 10 minutes. But the first thing, the reason why I am so passionate about mental health is because I am a person with lived experience in depression and anxiety. And since 2019, I have met this incredible network of young people who are working day in, day out to transform the state of youth mental health, not only in Kenya, but globally. And we have united these young people. We've done so many amazing projects together. We've made so much noise together, and we are very happy to see the progress that is currently happening in mental health in Kenya. So after we've done these projects from 2019 that I'm going to talk about, we decided that we are working in silos as young people. So why don't we form a consortium that is going to unite young people in Kenya as we working towards attracting young people in the region, and then work towards also attracting more young people globally who are very, very interested and are very passionate in mental health, looking as youth as advocates, youth that are in service, youth that are in innovation, and young people in research. So, in brief, Youth for Mental Health is a youth-led and a youth-focused network focusing on transforming the state of youth mental health in Kenya and beyond through research, intergenerational dialogue, mental health integration, and community innovative responses. So currently we have 4 colleagues, and we are happy that we are here with 2 more colleagues that are in Youth for Mental Health. I just tell Jolie to wave. I know she's coming here after me. And also we have David. David was here a while. And then we have Brian, who is in absentia. Thank you. So the focus area that we are looking at as Youth for Mental Health is research. So we realize that there's a lot of gap when it comes to youth mental health research, especially in Africa. So how do we work towards looking at the needs assessment of young people in the region? How do we use the data that we get in the needs assessment to come up with interventions for youth mental health, and how do we promote data use in decision making? The other thing we are also looking at is on the intergenerational dialogue. I was very happy to see that the theme for this year's International Youth Day focused a lot around intergenerational dialogue. And I think if you will barely witness, this is something that it's a very big challenge right now. We are not able to separate what is meaningful youth engagement and what is using youth as subjects just to write reports, come up with ideas and all these policies that are targeting young people but have not involved young people from the population stage. So looking at, can we develop labels that are geared towards meaningful youth engagement that other people can be able to use? Mental health integration in different areas such as climate change, socioeconomic status, because I think one of the things that we thought about when we are looking at this is that when we are looking at mental health issues, we're just putting a band-aid, but we are not going to the root causes of what is causing mental health issues among young people. So, looking into issues such as the social determinants of health and having this multi-sectoral approach in mental health drove us to that. And then community response mechanism, and I'm very happy to hear Pauline talking about human-centered design. Designs that are actually involving the people that we are targeting, from the population all the way to implementation. So we have 3 pillars. We're talking about integration. And just like I've said, we are aiming to design an advocacy strategy or a plan on how best we can integrate mental health into existing and new global and local programs such as climate change, UHC, SDGs. And then we also look to have continued engagements of various stakeholders through dialogues and webinar session on the needs and importance of mental health integration. Our second pillar is on amplifying, and we look to working with evidence-based approaches led by the communities and mostly young people, because we've seen the work that art is doing around mental health, integrating mental health into conversations that the youth are involved in, like sports, cultural activities, peer support, spirituality, technology, and also on utilizing the HCD approach in community responses and programs. Our last pillar is on collaboration. How do we identify and initiate interventions to address the gaps in effective collaboration? Focusing on skill gaps, knowledge gaps, and other gaps, and then continued dialogues in advocacy, and advocacy on inclusion and design and decision-making platforms. So, just like I said, we've done a lot of work since 2019 when we met and did this incredible thing that I'm going to talk about after this. And one of the things we've been focusing on mostly is on awareness raising. We have collaborated with various government bodies. We've also collaborated with various mental health organizations to talk about art, social media campaigns, community outreaches, and through that also we've done our advocacy work through this partnership. And one of the things that we really love doing also is on policy reviews and advocacy engagement through public participation. And some of the things that we've taken part on is on mental health action plan, the task force report, and suicide prevention strategy 2021 to 2026 that was launched this year. So here we see some of the highlights of the work that we've done. So this was our first joint project as Youth for Mental Health. It was a sensitization work in 2019. And the reason why we thought about doing this work is because for the longest time, mental health had been a taboo topic. And most of the time we go to communities, churches, wherever, and we've been chased away. So we just thought about how do we what project can we use to create massive awareness that we can target the youth, policy makers, private sectors, and then that's how we came up with this work. And this work was able to attract at least 2,000 participants. In 2020 and 2021, and this is just the major projects we did. We have other projects hapo katikati. So we've done a lot of social media campaigns and outreaches, and this is because of the COVID situation that was going on. We've had webinars on mental health and human rights, socioeconomic challenges on mental health. Just connecting this, what we're talking about mental health integration, and And as you can see, we've worked with various organizations. We've worked with CBM Global. We've also worked with Nairobi City Council, the Ministry of Health, Child Fund. I mean, so many organizations that we have done this amazing work with that have enabled us to reach a wide variety of young people, both online and in person. So for this year, we are trying to look at the intersection of art and mental health. And this was in collaboration with the Ministry of Health. And I think for the first time in a long, I don't even know if it's in a long time, it's the first time. Maybe those who have been in the mental health sector longer than I have can tell us. But for the first time, I saw the government approaching young people and asked us, to come up with an advocacy activity, and they were willing to remove the money for us to do this activity on the intersection of art and mental health. And we're very glad that also research is coming in this and bringing in evidence-based approaches on the role that art is playing in mental health. So some of our achievements are that we fostered collaborative efforts with various organizations in different developmental sectors of the government. We've also seen a lot of embracing with young people and mental health. So there's improved acceptance among young people through stigma and discrimination strategies on mental health in different geographical areas. And since 2019, we've been able to mobilize at least 150,000 young people, both online and physically, to date. We have also influenced the formation of the Mental Health Task Force in Kenya, because it's after the work that we did in 2019 that the Mental Health Task Force was formed and contributed to the formulation of the Mental Health Action Plan 2021 to 2025. We've also referred over 3,000 young people for mental health services through linkages and information provision. And also the other thing, we've enabled young people to develop meaningful relationships amongst themselves, therefore building a strong support system. I think for me, I have made the most amazing friends in the mental health sector. And like even seeing David doing this right now, I mean, just seeing the service that he's put together is a very big thing, and I'm very proud of him. And also it also created career and training opportunities for youth leaders, myself being a witness, because it's after all these things that we have done that for me, I actually got a job in Cities Right. And so many other people in our networks who have been able to get job opportunities and also get training opportunities, get fellowship opportunities. So it's been a good network for us. Thank you.
Let's give another round of applause. So we're going to go to our second presentation. She is